Hello, my name is Hannah. I'm a student nurse at Anderson University. Do you mind if I interview you today?
Not at all.
All right. What is your name?
Allison Newman.
All right. It's nice to meet you. What is your phone number?
317
Okay.
833 9290.
All right. And what is your address?
1218 Luce, Luce,
Okay.
Creek, Circle,
Okay.
Greenwood,
All right.
Indiana.
And what is your birthday?
May 31st, 1998,
All right. And where were you born?
Indianapolis.
Okay. What is your age?
19,
All right. And what is your gender?
female,
Marital status?
single,
Okay. And your occupation?
student.
What would you identify as your ethnic origin?
Caucasian.
All right. And your employer?
Anderson University.
All right. And what is your reason for seeking care today?
Just like a general wellness checkup.
Do you have any present health or history of this illness?
No.
Okay. What would you describe as your general health?
Good.
Okay. Do you have any illnesses as a child that bring your memory?
I had rotavirus.
Anything else?
No.
All right. Have you had any accidents or injuries, like a broken bone?
I broke my wrist.
All right. And how old were you when you broke your wrist?
10.
Okay. Anything else?
I sprained my ankle, severe sprain.
Okay. How old were you when that happened?
14.
All right. Anything else?
No.
All right. Do you have any serious or chronic illnesses? And if so, what age were you diagnosed with those?
I don't have any.
All right. And have you ever been hospitalized?
I have.
Okay. What for?
I had rotavirus.
Okay. And where were you hospitalized at?
St. Francis.
Okay. Any other hospitalizations that we should be aware of today?
I had a emergency surgery.
Okay. What kind of surgery?
I had an ovarian torsion.
Okay. Okay. And how old were you when that occurred?
I was 15.
Okay. Where were you hospitalized for that?
Riley Hospital for Children.
Anything else we should be aware of today?
I had a precancerous skin growth on my head I had removed.
Okay. And how old were you when that occurred?
13.
All right. Anything else?
No.
All right. Have you ever been pregnant?
No.
Okay. Could you possibly be pregnant today?
No.
Sorry. Thank you. And do you have any children currently?
No.
Okay. Okay. Are you up to date on all of your immunizations?
Yes.
Okay. Have you had your flu vaccine?
Yes.
Okay. When was your flu vaccine?
In October. Beginning of October.
When was your last physical exam?
August 23rd, 2017.
Okay. And do you have any known allergies?
Just seasonal.
Okay. And what happens when that's allergies occur?
I just take some allergy medicine.
Sorry.
Like antihistamine.
Okay, but like what are your symptoms with that?
Just like runny nose, sometimes headache.
Okay. And what are your current medications?
I take Zyrtec when necessary.
And do you know how many milligrams that is?
No, I don't.
Okay. What else?
And then I take low estrin, FE.
And milligrams on that?
It's just birth control.
Okay. All right. And anything else? Escitalopram?
Yes.
All right.
That.
And how many milligrams is that dose?
10.
All right. Anything else?
No.
All right. Do you have any history of heart disease?
No.
Okay. What about high blood pressure?
No.
Have you ever had a stroke?
No.
Okay. We already mentioned your allergies. Do you have asthma?
No.
Okay. Diabetes?
No.
Okay. A history of diabetes in your family?
No.
Okay. What about blood disorders in your family?
No.
Okay. Any breast or ovarian cancer?
Mm-mm.
Any other types of cancer?
Lung.
Okay. Does anyone in your family have sickle cell anemia?
No.
How about arthritis?
My grandma, my paternal grandma.
Who in your family had the lung cancer?
Paternal grandfather.
Okay. Is there any history of alcoholism in your family?
Maternal grandma.
What about mental illness?
No.
Okay. Any suicides?
No.
Anyone in your family prone to seizures?
No.
Okay. How about kidney disease?
No.
Tuberculosis?
Nope.
All right. So, your overall state of health, you said, was healthy. Have you lost or gained any weight recently that you were planning to do so?
No more than the usual.
Okay. Has your diet changed at all?
No.
All right. Have you experienced any fatigue or weakness?
Maybe fatigue.
Okay. And then any fevers?
No.
Chills?
No.
Have you sweat like random times of the day or in the middle of the night?
Not that I've noticed.
All right. Do you have any history of skin disease such as eczema, psoriasis, hives, anything like that?
Eczema.
Okay. And any like severe pigment changes or color changes? Any new moles?
No, that I've noticed.
Okay. Have you had excessive dry skin or like super wet skin?
I have dry skin in the winter.
Okay.
But that's pretty normal.
Yes. Any kind of bruisings?
No.
Okay. Any rashes?
No.
Lesions?
No.
All right. Any recent hair loss?
Nope.
Okay. Any changes in the texture of your hair?
Nope.
All right. What about your nails? Any change in shape or color? Okay. Have they been more brittle or anything like breaking?
No.
And have you had like a large amount of sun exposure lately?
No.
Okay. And how do you care for your skin?
I wash it.
Okay. Like with what?
Soap.
Okay. And your hair as well?
Yeah. Just shampoo and conditioner.
Okay. Have you had any severe headaches?
No.
Okay. Any head injuries?
No.
Okay. Dizziness?
Mm-mm.
Vertigo?
No.
All right. Have you had any new changes to your vision?
No, but I wear contacts.
Okay. You wear contacts?
Yep.
Okay. And what kind of contacts do you wear?
The brand?
No, like, do you wear, like, 24-hour contacts?
Oh, I
like,
take them out at night.
Okay. And are they good for a month, or?
Yes.
Okay. When was your last vision check?
Last July.
Okay.
So July 2017.
Okay. And were there any abnormal findings with that or anything like that? All right. Have you had any watery eyes or, like, discharge?
Just like with allergies.
Okay. No history of glaucoma or cataracts?
No.
Okay.
My grandfather does have macular degeneration, though.
Okay. Have you had any earaches or ear infections in the last little bit?
No.
Okay. Any discharge from your ears that's abnormal?
No.
Any tinnitus, like ringing in your ears?
No.
Or vertigo?
No.
Okay. Do you use hearing aids? Do you have any hearing loss? Okay. Do you have, like, prolonged exposure to, like, environmental noise? You said your occupation was a student, so if you don't do construction or anything like that. Okay. And then do you clean your ears regularly?
I do.
What do you use when cleaning your ears?
I use Q-tips.
Okay. Do you have any discharge from your nose? You said you have seasonal allergies. Are those
Yeah,
affecting you right now?
Yeah.
Okay. Is it normal discharge? Is it clear?
Yeah.
Okay. Have there been any unusually, like, frequent or severe colds?
No.
Okay. Any sinus pain?
No.
Okay. Nasal obstruction, so, like, a very clogged nose?
Not recently.
Any nosebleeds?
I've never had a nosebleed.
Oh, wow. Okay. Any hay fever?
No.
All right. Or have you noticed a change in your sense of smell?
No.
All right. And so we're going to move on to your mouth and throat. Do you have any mouth pain today?
No.
Do you have a frequent sore throat? Any significant bleeding gums?
No.
Toothaches?
No.
Okay. Lesions in your mouth, like cold sores?
I do have a cold sore.
Okay. Any hoarseness or change in your voice lately?
No.
Okay. Do you have your tonsils?
Yes.
Okay. Have you had any altered tastes? Okay. And how often do you brush your teeth?
Twice a day.
Okay. And do you have dentures or
No.
bridge? Okay. And when was your last dentist appointment?
January something. Of like 2018.
Okay. That's all. We just need to know the month and the year. Okay. And then your neck. Have you had any kind of neck pain or limitation of motion? You can move like normal.
Mm-hmm.
Okay. Do you have any lumps, like in your lymph nodes or swelling that you've noticed?
No, I've noticed.
Any enlarged nodes? Nope. Okay. And how about your breast? Any pain? Any lumps that you've
Not
noticed?
that I've noticed.
Okay. Any kind of discharge, rash? Okay. Do you have a history of any kind of breast disease?
Mm-mm.
And have you had any surgery on your breast?
No.
Okay. Your armpit? Any kind of tenderness, lumps or swelling? No rash? Okay. And do you use, excuse me, do you have breast self-examinations?
Yeah, sometimes.
Okay. How often?
Probably like once every other month.
Okay. Have you had any mammograms?
No.
Okay. So, we're going to move on to your body systems.
Mm-hmm.
Do you have any history of lung disease, such as asthma, emphysema, bronchitis?
This past summer I had some medical issues.
Okay.
So they were trying to diagnose me with asthma, like testing me, and we came to the conclusion that I don't have it at this point.
Okay.
But I was on asthma inhalers and medicine.
Okay.
For a few months.
Okay.
I did have that.
Okay. Any kind of other sorry. Do you have any chest pain when you're breathing?
Not usually.
Okay. Any wheezing or noisy breathing?
No.
Okay. Do you have shortness of breath?
No.
Okay. And then, does how much of activity produces shortness of breath? So, like, would you say that you're fairly healthy and in shape? So, like, going up one flight of stairs is okay, but going up like 3 or 4 kind of wins you.
Yeah.
Okay, that's normal. Any kind of coughing?
Not too bad. But no.
Okay. Any kind of sputum, so like mucus that comes up when you cough?
No.
Okay. And any kind of toxin or pollution exposure that you could think of that you
Not
had?
that I've known.
Okay. And then have you ever had a chest x-ray?
I have.
Okay. When was that?
I had 3 this past summer.
Okay.
So summer 2017.
Okay. And were those normal?
Yeah.
Okay.
I also had a CT scan of my chest.
Okay. Okay. We're going to move on to your cardiovascular system. Do you have any pain like around your heart?
No.
Okay. Any like super heavy beating that you've noticed or anything like that?
Just like when I exercise.
Okay.
But,
that's normal.
Yeah.
Do you have like skin discoloration or anything like that? Okay. And so if you does your heart race like more than usual when you exercise, or would you consider it pretty normal?
It's normal.
Okay. Any issues at nighttime, like your heart racing when you lay down to go to sleep, or maybe your heart rate racing when you stand up from a sitting position? Good. All right. And then, do you have any history of heart murmurs or hypertension?
Not me personally, but my
Okay.
family has a hypertension.
Okay. Lots of people in your family?
Yeah.
Okay. Any history of coronary artery disease?
Not that I know of.
Okay. And any anemia?
No.
Okay. Have you ever had an ECG?
No.
Okay. Or any other kind of heart tests?
No.
Okay. For your some of your veins and stuff in your body, have you experienced any numbness or tingling, like in your feet or hands?
Mm-mm.
Okay. Any coldness out of the ordinary?
I don't think so.
Okay. Swelling of any kind of your legs?
Mm-hmm.
Okay. Any discoloration, like pale or maybe red?
Mm-mm.
Okay. Do you have varicose veins?
No, but my family does.
Okay. Lots of people in your family?
Like my parents
Okay.
and my dad's parents.
Okay. Do you have any ulcers, like in your veins or anything like that?
Mm-mm.
Okay. And does your work involve long-term sitting or standing?
Sometimes, just depends on the day.
Okay. So, how do you sit when you are sitting? Like, do you cross your legs?
Yeah, I usually cross my legs.
Okay, so sometimes that can lead to a little bit of your feet falling asleep, right?
Mm-hmm.
So you get the tingling. So maybe you should avoid crossing your legs. Try to sit with them flat on the floor. Okay. That's what this says. Have you noticed any changes in your appetite?
No, I don't think so.
Okay. Do you have any food intolerances?
No.
Okay. Any kind of heartburn or indigestion?
Just depends on what I eat.
Okay. Any kind of other abdominal pain, like cramping or any kind of pain associated with eating, so like swallowing or anything like that? Okay. Do you have any kind of burning sensation, like when you lay down after eating, like it burns in your esophagus? Okay. Any nausea and vomiting with It's out of character, like not with the
No.
sickness. Okay. And have you ever vomited blood?
No.
Okay. Do you have a history of any kind of abdominal disease, like ulcers or liver?
No.
Okay. Do you have your gallbladder?
I do.
Okay. Do you have your appendix?
I do.
Okay. Do you like have regular gas? Like,
Yeah.
Yeah. Okay. And then how often do you have a bowel movement?
About once or twice every day. At least once. Sometimes two.
Okay. So pretty normal going on
Yeah.
down there. Any kind of recent changes?
No.
Okay. How would you describe your stool?
It's normal.
Okay.
It's like brown.
Okay.
And
Is it formed or?
yeah, it's pretty formed, but it's not like too formed.
Okay. So like soft serve ice cream.
Yes,
Okay.
also ice cream.
Have you had any constipation or diarrhea?
No, not recently.
Okay. And then have you ever had any black stools?
No.
Okay, that's good. Any source of rectal bleeding that you're aware of?
I have had blood in my stool a few times,
Okay.
but I don't know what it's from.
Okay. Do you have any rectal conditions like irritable bowel or anything like that? Okay. And have you ever had hemorrhoids
No.
or fistula? Okay. Do you use antacid or laxatives?
I use an antacid like very rare occasions, but if I need it.
Okay. For just the heartburn related to food?
Yeah. And then I've used a laxative once after surgery.
Okay. That's a one-time thing. Sometimes your
Yeah.
pain medicine after surgery can mess you up a little bit.
Yep.
How often do you urinate?
I say pretty often.
Okay.
Like, I don't know, 4 to 5
4 to
times
5
a day.
times. Okay.
That's I guess.
Do you ever have like the sudden urge to urinate, or is it pretty like you kind of know when it's gonna
yeah.
happen? Okay. Do you have to get up in the middle of the night to urinate usually?
Yes.
How often?
Just like one time.
Okay.
And
Is
I-
this a recent thing?
Yeah. I think it's just because I've been drinking more fluids.
Okay. So related? You think it's related to your fluid intake?
Yeah.
Okay. That's all right. Nothing wrong with drinking more water. Okay. Have you had like a lot of your you think you pee a lot, or just like a normal amount?
Just a
Okay.
normal amount.
Is it like when you go to the restroom? Does it like just strain on your body, or does it just flow out like it should?
Mhm.
Okay. Any kind of narrowed stream, like it kind of dribbles out? No. Okay. And is it a regular color?
Yeah.
Okay. What color would you describe it as?
Like a lighter yellow.
Okay.
Not dark.
Any
Or concentrated.
history of incontinence?
No.
Okay.
But I have had a UTI before.
Okay. All right. How many?
Just one.
What was that related to?
I think just like I was in sweaty clothes for a while.
Okay. So just like a normal
Yeah.
you didn't change after exercising or
Yeah.
something like that. Okay. Have you had any pain urinating or in your groin area, around your pubic region at all, or your lower back?
Nope.
Okay. Have you? How did you treat your urinary tract infection?
I had an antibiotic.
Okay. And then, do you use the use of Kegel exercises can strengthen your pelvic floor if you ever feel a need to, if you're worried about incontinence issues. So, all right. You are not a male, so that does not apply to you. You are a female, though. So, when did you begin your first period?
I think in 7th grade.
So you were like 12 or 13?
Yeah.
When was your last menstrual period?
About a week ago? 2 weeks ago?
So like the beginning of February?
End of January, yeah.
End of January? Okay. So like 2, 1, whatever. Something like around that age.
Yeah, that's fine.
Okay. Do you have like a normal cycle? Like do you regularly have a period?
Yeah.
Okay. And how long does it usually last?
About like 3 days. 3-4 days.
You're one of the lucky ones that we read about. Any kind of lots of bleeding or not a lot?
Not a lot. No.
Okay. And premenstrual pain?
Yeah, I would say
Okay.
I have pre and post.
Okay. And then, do you ever bleed in between periods?
No.
Okay. Vaginal itching? Any kind of abnormal discharge?
I don't think so.
Okay. And you obviously probably have not had menopause yet, correct?
No.
Okay. Any sign of symptoms of that?
No.
Okay. When was your last gynecological checkup?
July of 2017.
Okay. And did you have a pap smear at
No.
that time? Okay. Have you ever had a pap smear?
No.
Okay.
They don't test until you're 21.
Right. Your sexual health. So, are you presently involved in intercourse?
No.
Okay. You use contraceptives, but not for
Yeah, for my period.
for your periods. Okay.
And I have a history of cyst,
Okay.
ovarian cyst.
Okay. All right. Do you personally have a history of arthritis or gout?
No.
Okay. Any kind of pain or stiffness in your joints? Would you say any of your joints are abnormally formed or anything like that?
I don't think so.
Okay. Have you recently had any limitations of motion?
No.
Okay. Any noise with joint motion, so like cracking?
Yes.
Okay. How would you describe that noise?
Whenever I walk, my lower legs, like whether that's my knees or my shins, or ankles, something pops.
Okay. Which leg? Just
Both.
Okay.
And I have also busted the sacs of fluid behind my kneecaps, so the
Okay.
bursa sacs. When I was 15.
In your muscles, do you have any kind of muscle pain or cramps?
No.
Okay. Any weakness?
No.
Any problems with walking or problems with coordination?
I'm clumsy, but
Okay.
nothing
Nothing like.
No.
Okay. Any kind of stiffness?
No.
Okay. In your back, is there any kind of pain?
No.
How much do you walk per day?
Generally like 10,000 steps.
Okay.
So I don't know how that equivalents to.
You know, I'll just write down 10,000 steps, and I think that's a pretty good amount of walking. And you don't have any limited range of motion, so
No.
and you don't use like a walker or anything like
No.
that, right? Okay. Do you personally have a history of a seizure disorder?
No.
Any kind of strokes?
Nope.
Fainting?
No.
Blackouts?
No.
In your motor function, do you have any weakness? So like your arms don't move a certain way if you want them to. Do you have a tic or anything like that?
No.
Have you ever experienced any kind of paralysis?
No.
And again, any kind of coordination problems?
No, I don't think so.
Any numbness and tingling? No? Okay. Any kind of memory disorder? So like amnesia or Alzheimer's?
No. Nothing like that. I mean, I'll forget things once in a while, but.
Are you nervous?
Right now?
No, just in
No.
general in life.
Like when I have like something big coming
Okay.
up, but nothing like bad.
Related to normal stress, right?
Yeah.
Okay. Do you have any depression or anxiety?
I have anxiety.
Okay. And do you have any history of mental health dysfunction in your family?
No.
Okay. And any kind of hallucinations?
No.
Okay. Have you had any kind of bleeding tendency? So like, does your skin bleed more than it should? Like it feels like it's thin?
No.
Okay. Any kind of excessive bruising?
Yes.
Yes.
I will bruise really
Okay.
easily
Okay.
if I hit something. But that's it.
Okay. And have you been exposed to any kind of toxic agents or radiation?
Not that I know of.
And have you ever received a blood transfusion?
Nope.
Okay. Do you have a history of diabetes?
No, not me.
Okay. Any, like peeing a lot or
No.
excessive thirst? Or excessive hunger?
No.
Okay. Do you have a history of thyroid disease?
In my family, we have hyperthyroid, but nothing.
Okay.
Like, not me, no.
Okay. Do you have a severe intolerance to hot or cold, like temperatures outside?
No.
Okay. Has your skin changed in like its texture at all? Like, does it seem thin or tough or anything like that? You mentioned before that you haven't experienced any excessive sweating. Would you say that your appetite reflects your weight as well? Like
Yeah.
You're not larger than you think you should be. You're
Yeah.
smaller. Okay. And then, do you have any like abnormal hair distribution?
No.
Nervousness, just related to the
Yeah.
normal stress. Any kind of tremors?
Nope.
Have you ever been on hormone therapy?
Just birth control.
Okay.
Right now.
Okay. What was your last grade completed?
My last what?
Your last grade of school?
13.
So are you you're
in college.
in college? Okay. Have you ever had any other like significant training in any job related field or anything like that?
I don't think so.
Okay. Would you say your financial status is pretty good?
Yeah, I'm independent
Okay.
with my family.
Okay. Do you have normal, like any religious practices that?
Yeah.
Okay. What would you consider those?
Christian.
Okay. And what are some of your personal strengths?
Positivity
Okay.
and honesty
Okay.
and loving.
Okay. Do you have any health concerns, like where you live or anything like that?
No.
Okay. And what are you studying in school?
Nursing.
Do you have any self-care behaviors, like bubble baths or reading or anything like that?
Take a shower.
Okay.
I don't know, just like relax.
What do you do to relax?
I watch TV and I hang out with friends.
Okay. Would you say what kind of activity style would you consider yourself to have?
Normal?
Okay. Like a normal activity, like
Yeah, like there's no limitations.
okay. You are independent when it comes to feeding, bathing.
Yeah.
Okay. What are some of your leisure activities?
I play tennis.
Okay. Anything else?
Color.
Coloring? Okay.
And I like to like hike and be outdoors.
Do you like work out in a gym or anything like that?
Sometimes.
Okay.
If I have time.
Okay. Any other kind of self-care behaviors?
No, I don't think so.
Do you have a normal sleep pattern? What time would you say you go to bed every night?
Around 12:30.
Okay. And what time do you get up?
Usually around 8. I mean,
Okay.
it just depends on the day.
Do you take any regular daytime naps?
No.
Okay. And do you use any sleep aids?
Nope.
Okay. Okay. What can you recall what you've eaten in the past 24 hours?
I had a bagel for breakfast.
Okay.
And I had chicken tenders. and fries for lunch.
Okay.
And a salad for dinner.
And you had urinary elimination today.
Mm-hmm.
When was the last time you urinated?
Like 3:15.
Okay. And have you had any bowel movements today?
Yes.
What time do you think that was?
1:15.
And is there a menu? Is this like typical what you would eat every day?
Yeah.
Who buys the food for you?
Me.
Okay. Who prepares the food?
Me.
Okay. And would you consider your finances adequate for food?
Yeah.
Okay. Who is present during meal times?
My friends.
Okay. Do you have any self-care behaviors related to food or anything like that? Do you have like a particular place you go to eat or a particular place you go to the bathroom?
No.
Okay. What would you describe as your role in your family?
Daughter.
Okay. Do you get along well with your family, friends, coworkers, and classmates? Okay. Do you get support? Who would you get support if you have a problem? Who would you go for support?
That's my parents.
Okay. How much time do you spend alone per day?
Probably like 5 or 6 hours.
Okay.
Maybe, I don't know.
Would you consider that pleasurable or isolating?
Pleasurable.
Okay. Do you have any other self-care behaviors that are related to being with other people or anything like that? No? Okay. What would you consider your stresses in life right now?
School.
Okay. Anything else?
Work.
Okay. Anything besides those?
No.
Okay. What are some of the biggest changes that have happened in the past year?
I moved.
Okay. Multiple times, right?
Yes.
Okay.
Just friends.
Okay. Anything besides that?
I don't think so.
Okay. What are some of the methods you use to relieve stress?
I talk. Talk it out.
Okay. Anything else?
Plan.
Okay. Anything besides that?
Accomplish it. Get it done. And then I cross it off.
Are these helpful?
Yes.
Okay. What would you consider your daily caffeine intake to be?
I like caffeine.
Okay.
So I would say like maybe anywhere from 2 to 4 cups. I mean, it just depends on the day. If I
Of what?
I like coffee and tea.
Okay.
Sometimes cola. Really all of it.
Okay. Have you ever smoked cigarettes?
No.
Okay. Have you ever used alcohol?
No.
Any use of street drugs?
Nope.
Marijuana?
Nope.
Crack cocaine?
Nope.
Barbiturates?
No.
Heroin?
No.
Cocaine?
No.
Amphetamines? LSD?
No.
Any other that we should be aware of today?
No.
Okay. Have you ever been in treatment for drugs or alcohol?
Nope.
What type of housing do you have? Would you say you live like 9 months out of the year?
A dorm.
And do you have neighbors?
Yes.
Do you live alone?
Yes.
Would you consider that area to be safe?
Yeah.
Okay. Do you have adequate heat and utilities like water?
Mm-hmm.
Okay. Do you have access to transportation?
Yes, I have a car.
Okay. Are you involved in community services at all?
Mm-hmm.
Okay. What type?
Like I volunteer.
Okay. Any kind of hazards in your workplace or at home?
No.
Do you use your seatbelt?
Yes.
Have you ever traveled to or lived in another country for
Yes.
a long period of time?
Nah, like I haven't lived in there, but
Okay.
I've traveled.
Where have you traveled?
Mexico
Okay.
and El Salvador. And the Caribbean. And Canada. As I remember them.
Have you had any military service in other countries? And any self-care behaviors related to caffeine, smoking, anything like that?
No. I like coffee. That's really it.
Okay. Have you ever had, do you feel safe in your own house with your partner?
Yes.
Have you ever been emotionally or physically abused by someone that's important to you? We're almost done. Have you ever been hit, slapped, kicked, punched, or shoved, or otherwise by a partner?
No.
Has your partner ever forced you into having sex? Okay. Are you afraid of your partner and ex-partner?
No.
What kind of job do you do?
I work in the admissions office.
Okay. And what kind of job is that? Would you like?
Customer service.
Okay. Are you ever around any chemicals or anything like that? Do you have this repetitive motion that you would consider that you do, like copying all the time or anything like that?
No.
Okay. Is there any equipment designed to reduce your exposure to anything? Are there any work programs designed to monitor exposure to these chemicals?
No.
Sorry.
It's okay.
Got this part out. I'm sorry. I don't know what's going on. Okay. Having a mental breakdown. Okay. Do you have any health problems that are related to your job?
No.
Okay. What do you like or dislike about your job?
I like the people.
Okay. What do you dislike?
Some people.
How would you describe health? Like, what is your ideal health? Like, your ideal definition of health, of a healthy person?
To be like healthy, like be well-rounded, like
Okay.
exercise and diet, and like mentally and physical status.
Okay. Would you view yourself as that right now?
Mm-hmm.
Do you have any concerns about your health at all?
No, I don't. I don't think so.
Okay. And what do you expect will happen to your health in the future?
I hope it'll get better or continue to stay the same.
Okay.
Like if there's always room to improve.
Mm-hmm. And what are your health goals?
To lose some weight and keep managing my anxiety.
And do you have any expectations of the nurses or physicians today?
Just like friendly and caring, informative.
All right, I think that is it. Do you have any questions for me today?
I don't think so.
All right. Well, it was great to meet you.
It's nice to meet you too.